So, please.
Thank you to the organising committee and to the university and NOHS for inviting us to be here today. It's been an absolute honour. I want to speak about tips for successful outcomes, not just in speech therapy, but also in comprehensive self-care. What's the best evidence-based outcomes for every patient that we'll see with a cleft lip palate? I want to cover outcomes in general, international project outcomes, the cleft Q, qualitative and quantitative patient outcomes with regarding to speech, as well as the outcomes of the NHOS in terms of speech outcomes. And of course there'll be some takeaway messages and some tips. So this presentation actually follows from our presentation at last year's conference when the doctor actually asked us, why do many of our patients have speech problems? My answer was, as speech therapists, we can't answer this problem alone. The issue must be addressed by the full team. So are we providing the best care? How do we know? Everyone deserves the best care. Measurement is essential. So how do we know if our outcomes are good? We need to measure and check our performance to improve by using traditional clinical audits which focus generally on clinical processes, which we discussed last year. Clinical audit has been defined as a systematic, critical analysis of the quality of care, including procedures for diagnosis and treatment, the use of resources, and the resulting outcome and quality of life for the patient. Whereas PROMs, which may be new to many people, I'm not sure, are surveys about the patient experience. Patient-reported outcome measures are a clinical tool. It tells us how the patient feels about their speech, about their hearing, and about their appearance. There have been a number of studies done. A seminal study which has been written up was done in the UK. The Clinical Standards Advisory Group was set up to look at standard procedures for measuring cleft outcomes. And of course they determined that certain features should be evaluated in terms of facial development and appearance, quality of bone grafts, speech, oral health. The added extra component was a patient and a parent survey of satisfaction. From that information, they decided what the standardised outcome records should include, and I'm not going to go through those, you'll be familiar with them, but in terms of patient satisfaction or family of the patient, their satisfaction is very important. As speech therapists, we tend to focus on that, and of course we do audio and visual speech recordings. There have been a number of studies around the world, the EuroCleft study, the Scan Cleft project, and the Ameri Outcomes project, and you can read about that in many journals. So the patient family and family must be actively involved in patient and family-centred care. They have to be able to participate in patient-reported outcomes. The patient and the family, they are the most important part of the team. I think we often think of the cleft team as being all the professionals and the specialists, but the family and the patient are actually the most important component. So of course we treat them with dignity and respect. We encourage the patient or the family to participate in the management of the problem. We need to collaborate, and we need to give them information. Often we find that as professionals we cluster around the patient, talking in a language the patient doesn't understand. The patient must understand what we're talking about so that they can make a good decision about their ongoing management.
At my hospital, as a speech therapist, I am actually is the the vertical is synchronous, not on this line. So we run the fifth pelvis vertical from the pose repair of the newborn baby to 1 to 3 years old, to 3 to 5 years old, and to 6. Yes, and we review the speech outcome prior to school entry, and then at 10 or 12 years old of age, and possibly post VBI surgery or orthodontic surgeries. But do we use patient-reported outcome in any of the care teams? But when do team member or the team as a whole collective assess patient outcome and how? The first study of the treatment outcome, a patient with a graphic and palate in the central Vietnam was done by a dentist, Dr. Van Thanh, and the outcome found was a summary on the screen. You can see it's mainly about the tooth oral health, the dental care, the gingivitis, the mother's sadness when they see the newborn baby having flaps. More than 50% of children have hypernasally, that's meaning air protrusion all the time. And the last screen, malabsorption. And the patient and parent satisfaction with black treatment outcome is recorded by the black hearing of hearing and speech questionnaire. And the final is the low to moderate agreement between the patient and parent prednisone. The CHASQ is an outdated, and now we view the GLAPQ questionnaire, and it indicates they have to say how the patient happy about their appearance, hearing, and speech. The France questionnaire we use is the SBAC. This question increases understanding of individual children and the context in which they live. It increases the categories of activity and participation, environmental and personal factors from the International Classification of Functioning, Disability, and Health. We've done a data survey in April 2026 at the Comprehensive Lab Care Center at Adultos Stomatology Hospital, Hotel City, and this is you are seeing the result. The speech participation, we use this form and activity assessment of children, evaluated people's feeling and participation in communication across context, friends, family, school, class participation, and misunderstanding situation rather than the pure speech accuracy. These questions increase the understanding of individual children and the context in which they live. It embraces the category of activity and participation, environmental and personal factors from the International Classification of Functioning, Disability, and Health. And here the summary result from the data survey. There are 21 flat patients of NHOS and hospital rated their feelings from happy to unhappy about a number of situations. Today we only focus on the patient number 1. How do you feel when you talk to your preschool teacher? And question number 10. How do you feel when the people don't understand what you say? In question number 1, in the number 6, you can see there's one patient, 8 years old boy, is happy about his speech. But this is maybe he is not aware or nobody told him that his speech is abnormal. And most people show that they are not happy about the way they speak. And in the question 10, how do you feel when people don't understand what you say? Most people are not particularly happy about it. They are not being understood.
So let's look at how it affects speech, appearance, function, and their mental health. We all know that. The cleft Q is the first condition-specific tool to assess quality of life in persons and palate patients. It's been rigorously developed and it can be used internationally to collect and compare evidence-based outcomes from patients aged from 8 to 29 years with cleft lip or palate. It's composed of many scales. The three major areas are one of appearance, and you can see the face is broken up into jaws, nose, etc. Facial function, which actually includes eating and drinking, as well as speech, and health-related quality of life issues, including psychological, school, social, and speech distress. And it is the speech distress that we tend to use in Australia in terms of how distressed does the patient feel when they're talking to somebody, when they know that their speech is different. The ICHOM is actually the framework of standards. It's a set of standard outcomes agreed upon by an international working group that helps us to look at outcomes that matter most. Not the outcomes that matter most to us, but the outcomes that matter most to patients with cleft lip and palate. And of course, they are going to matter to us as well. So the takeaway messages, we know that we already use some standardised clinical audit outcome measures to track performance and so to improve, but we need to start using PROMs. Patient surveys of satisfaction are very, very important. And they're important because we can then benchmark ourselves, we can assess our performance against other hospitals, nationally and internationally, and also measurement helps us to give feedback to families. I'd just like to introduce you to the Circle of Cleft Professionals. It is a worldwide network of over 500 cleft professionals from over 70 countries. Some of you may know about it already. It's free to register and to join. They have fabulous professional development seminars online, which are also free. And on May the 20th, they're actually doing a seminar on beyond surgical success, patient-reported outcomes after cleft care. And I would really recommend people who are working with these children and adults to tune in and go online and have a look at the seminar. Thank you for your attention.
Thank you for your interesting topics, and I think that we have a close relative between the surgeon and speech therapist in the future. So I would like to invite Dr. Jan to give certificate for the speaker. So